at what point does it require surgery? At what point can it be treated using physio and chiropractic? And what usually happens when it's physio and chiropractic?
Sure. So, obviously, beyond the physical examination of the patient, and also determining the severity of the scoliosis, that's now when we use the full spine X-rays. And the severity of the scoliosis will be determined by an angle of measurement in radiography called the Cobb angle. And the Cobb angle helps us to know how severe the scoliosis or the curvatures in the spine are. So between, I believe, 10 to 20 degrees, it's mild. That's definitely chiropractic physiotherapy.
That's how much
the curvature is. Yes, okay. A 20-degree angle.
All right.
So that's definitely managed by chiropractic and physiotherapy, and obviously with great reduction. When you get to 20 degrees to about 35, 40 degrees, that is actually moderate. Mm-hmm. And that one there obviously will require, chiropractic and also physiotherapy, but for a longer period of time because of how now the angulation has increased to that particular moderate angle.
So the treatment period will be much longer.
Much longer. And there's a commitment factor for the patient and the family to actually stick with it.
So what are we looking at? A year? 10 years?
I would definitely say anywhere from 4 months to about 7, 8 months because of the severity of the angle, the Cobb angle. Above 40, 50 degrees, that becomes a condition and a situation whereby you'd have to start looking at surgery because of the degree of curvature that is there, the implications of what that curvature is doing in terms of how different organs are functioning, like your lungs and your heart and different other things as well, but also to how fast it got there, That's why when we actually take the x-rays first of the client to determine how severe it is, most parents would not want, obviously, to have their children under a knife, go for surgery.
Yeah.
So when we have clients who actually say, no, I want my child to actually just do the best that we can, say, okay, we'll do what we can, but it will require serious commitment, right? Mm-hmm. Because even as we're treating the client and the patient, we'll be taking what they call progress x-rays to see if we're doing anything to help change the curvature of the scoliosis. So can we decrease that Cobb angle? But at the same time, in the back of our minds, we recognize that this could also be a surgical consultation because of, number one, if that patient is in their growth spurt, if nothing's done to stop that particular scoliosis at that severe degree angle, it will just get worse, right? And then secondly, too, in terms of commitment, and this is where now we talk about having the client and their parents agree that they have to take their child out of school to get treated. And that can be hard, right? Because you have children who are either in boarding school. And also, to the time factor and commitment, taking the child for physio and chiropractic treatment. Also, what she needs to do, is there bracing to be done at home? What exercise does she have to do outside of our treatment times? So that's going to be a very strict and very, mentally, you have to be mentally prepared for that. And even there are no certain guarantees that will fix it, because obviously that will depend on those other factors that we cannot control as physicians. But we do the best that we can to then see, okay, if we can even reduce it even to about 10, 13 degrees, from either 50 to 35, 36, that's better than nothing, right?
And life can be as near normal.
Exactly, as near as normal. But there has to be a commitment to the treatment itself, because that's the reality. That's what you present with, and the key thing is detecting the scoliosis earlier before it gets to that progression. Yeah.